Hello, class. Okay, so let's start with the lecture about Enterobacteriaceae and other gram-negative microorganisms. So as we all know, Enterobacteriaceae natin divided siya into two classification. We have here the opportunistic pathogens and also the overt pathogens. Kapag sinabi mo opportunistic, ito yung mga normally found sa environment. However, they can cause infection if the patient is immunocompromised or if the bacteria is able to go to other side of the body. So most of the opportunistic pathogen, they are part of the gastrointestinal flora. But if they go to other parts of your body, tulad ng blood, or even in your urinary tract, they can cause infection. Yan ang characteristic ng opportunistic pathogen. Kapag naman true pathogen or overt pathogen, these are the ones that really can cause gastroenteritis or other infections. These are the true pathogens. And you have here your Shigella, Salmonella, and Yersinia. Those are the overt pathogens. Now, kaya tinawag sa ng Enterobacteriaceae, ano ka na ng general characteristic? Again, most of them can be found sa gastrointestinal tract, kaya tinawag na Enterobacteriaceae. Another characteristic is that most of them are oxidase negative. Nag-iisa lang ang kanilang oxidase positive, which is the Plasmodium shigelloides. Yan lang ang nag-iisa na oxidase positive Enterobacteriaceae. The rest are oxidase negative. Okay? Ano pa? So most of them are glucose fermenters. Most of them are glucose fermenters. However, some of them can ferment lactose. Yung iba does not ferment lactose. So meron tayong lactose fermenting, meron tayong mga non-lactose fermenting. Can you still remember yung mga lactose fermenting natin? Those are the KEE, known as the Klebsiella, Enterobacter, and Escherichia. Diba? Yun ang ating mga lactose fermenting microorganism. Okay? So, let's proceed with the rest. Okay, so first it will be your Enterobacter and also your Escherichia and also your Klebsiella. These are your lactose fermenting microorganism. Now, when it comes to the characteristic of the colony, the Enterobacter, Klebsiella, and Escherichia, all of them will give pink colonies on the Macoki agar kasi nga sila ay lactose fermenting. However, pagdating sa consistency, Enterobacter and Klebsiella, they are very similar because both of them can give you mucoid colonies, particularly the Klebsiella that has a capsule, okay? Now, since Enterobacter and Klebsiella, both of them produce mucoid colony, you have to differentiate them from each other. Whereas you're going to perform the motility testing. Take note that Enterobacter is motility positive, Klebsiella is motility negative, okay? Pagdating naman klase Escherichia coli natin, ano ang common disease being caused by this one? It commonly causes UTI, okay, UTI, and of course, gastroenteritis. The same is with the Enterobacter. For the Enterobacters, they can also cause UTI, they can also cause gastroenteritis, and sometimes even wound infection, or even sepsis, just like your Escherichia coli. But take note, class, na pagdating sa E. coli, the one that produces sepsis sa E. coli is the one that has a capsule, which is the E. coli Ki positive. Okay? Or what you call the E. coli capsular antigen positive. Yun klasang E. coli that can cause sepsis and even meningitis, lalo na class sa mga neonates or newborn. Okay? So, Escherichia coli is motile. Ano pa klaseng characteristic niya? You can culture it saan? Sa EMB agar. It can give you a greenish metallic sheen on the EMB agar. Okay? So, take note of the characteristic of your E. coli. Okay? How will you distinguish the E. coli from the Klebsiella and the Enterobacter? Take note of the citrate reaction. Okay? Take note that most Enterobacter and most Klebsiella, most of them are citrate positive. However, Escherichia is citrate negative. So kapag citrate negative, lactose fermenting, it can be Escherichia coli. Also take note of the indole production, okay? It is indole positive. Ang ating mga E. coli, they're all indole positive, okay? So, for the E. coli, most of them are part of the flora. You can see them sa ating gastrointestinal tract. However, class, some strain of the E. coli are known to be pathogens. Sino yung mga pathogens natin? First, we have the ETEC, which is also known as the enterotoxigenic E. coli, okay? So, for the For the ETEC class, it is known to cause traveler's diarrhea because of the important virulence factor, heat laban and heat stable enterotoxin. Okay? Another one is the EIEC. For the EIEC, this is known to cause dysentery that is similar to your Shigella infection. Okay? So it has virulence factors that are similar to the Shigella. It produces what you call the Shigella toxin. Shigella toxin. Okay? So another one is the EPEC. For the EPEC, this is known to cause infantile diarrhea. Okay, infantile diarrhea or diarrhea in infants. So the virulence factors are the bundle-forming pilus, intamin, and other important and other virulence factors. Okay. Next is the ESTEC, formerly known as the EHEC. Okay, that is known to cause the HUS or hemolytic uremic syndrome. Okay. Now for the ESTEC, it also has a toxin that is similar to the Shigella. It also produces what you call the Shigella toxin. Okay. So that's why you can have a complication here known as the HUS or the hemolytic uremic syndrome, wherein the infection will now affect the kidneys. Yan class ang characteristic ng iyong ESTEC, also known as the EHEC, okay? Or the enterohemorrhagic type. And of course, we have here the EAEC. For the EAEC, this is the one that can either give you diarrhea or UTI. Okay, this is the aggregative type, okay? It also has a P-like and ST-like toxin, okay? So next is the Klebsiella. So for the Klebsiella class, again, magkapareho sila ng characteristic ng Enterobacter. Both of them are also citrate positive, Enterobacter and Klebsiella. And also, they produce lactose-fermenting mucoid colonies. That is their common characteristic. So anong difference ni Klebsiella from Enterobacter? You may check for the motility testing because most of the Klebsiella are non-motile. And definitely, Enterobacter, they're all motile. So motility can be the differentiating characteristic between the two. So take note of the different important species of the Klebsiella. You have here the Klebsiella pneumoniae, Klebsiella oxytocin, also the Klebsiella rhinoscleroma. Now, the most commonly isolated is, of course, the Klebsiella pneumoniae. That is known to cause UTI and sometimes sepsis because it has a capsule, di ba? For Klebsiella pneumoniae, again, it can also cause pneumonia. Kaya nga tinawag na pneumonia kasi nga it causes pneumonia or respiratory infection. Now, besides that, you also have the oxytocin that is associated with hemorrhagic colitis and rhinoscleromatis and ozonae associated with rhinoscleroma and atopic rhinitis, which are both infection on the upper respiratory tract. So that is your Klebsiella. Now, next is, so these are the different characteristics of your Klebsiella and how do you separate them? So take note, when you separate the Klebsiella, the first test you're going to look for is the indole testing. If it is indole positive, the answer is Klebsiella oxytocin. If it is indole negative, definitely it is the Klebsiella pneumoniae. Okay? Now, next is the Proteus, Providencia, and Morganella, collectively known as the PMP group. Now, how do you distinguish the PMP group from the rest of the Enterobacteriaceae? You have to perform what you call the phenylalanine deaminase testing or the PAD. Okay? So for the PAD, as we all know, it can separate PMP group from the rest of the Enterobacteriaceae. It is positive for the PMP group. Now, once you see it is phenylalanine deaminase positive, anong test yung next mo titignan? You have to check for the H2S production, okay? Because once you saw that it produces H2S, then the answer is automatic to be Proteus. Now, for the Proteus, you have two species. You have the Proteus mirabilis and also the Proteus vulgaris. You can differentiate them from their indole production. Mirabilis is negative for the indole, vulgaris is indole positive. Another difference between the two is their disease progression. So both the mirabilis and the vulgaris, they can cause UTI. But it is the mirabilis that can cause also kidney stone, okay? So it causes kidney stone because of the high urease activity of the Proteus mirabilis. It produces the enzyme urease that hydrolyzes urea from your urine, producing high amounts of precipitate such as ammonia that can cause precipitation of the salts and calcium in your system that can cause the formation of kidney stone or strobite, okay? Or what you call that, renal calculi, okay? Now, another characteristic ng mga approaches natin is that they tend to swarm. Meron silang characteristic na swarming phenomena. It also has a burnt chocolate or chocolate cake odor. Now, the other one is your Morganella, okay? Now, for the Morganella, how do you separate the Morganella from the two? So, after checking for the H2S, definitely it is the proteus, right? The next test you're going to look for is the citrate reaction. If it is citrate negative, then the answer is Morganella. If it is citrate positive, then the answer is Providencia, okay? Now, for the Morganella, it is rarely a pathogen, okay? It rarely causes infection. If ever you encounter it, it can be associated with UTIN, neonatal sepsis, okay? Because most of the time, Morganella is part of the flora of our gastrointestinal tract. So, nagiging accidental na pathogen lang siya. It can cause UTIN, neonatal sepsis. Again, it is citrate negative. Now, for the Providencia naman class, so for the Providencia, they are implicated with UTI, diarrhea, and sometimes sa mga wound infections. And these are the important pathogens. You have the alkali faciens, you have the Rickettsia, and also the Stwarty. For the Rickettsia, it can cause UTI and diarrhea. Stwarty associated with burn wound infection, and alkali faciens associated with diarrhea in children. Now, when it comes to the biochemical characteristic, to take note of the following. Sabi ko nga kanina, ang proteus, meron silang H2S. The rest are negative for the H2S among the PMP group. And then to separate Morganella, take a look at the citrate reaction. Take note that Morganella is citrate negative. Okay? But the rest of the Providencia, they are citrate positive. Okay? So that's how you separate the following from each other. Now, next is the Serratia. Now, for the Serratia, it is the only one among the Enterobacteriaceae that is DNase and OMPG positive. So, lahat ng Enterobacteriaceae, DNase negative, OMPG negative, except for Serratia, particularly your common pathogen, which is the Serratia marquescens. Now, Serratia marquescens, they tend to produce a pigment known as prodigiosin. That's why, if you can see here on the picture, it produces red colonies, okay? But in terms of lactose fermentation, Serratia marquescens is classified as late lactose fermenting together with the Citrobacter, okay? So, when you say late lactose fermenting, ibig sabihin noon, they will form lactose fermentation after more than 24 hours of incubation. That is for the Serratia marquescens, okay? They are late lactose fermenting, just like the Citrobacter, okay? But how do you separate Serratia from Citrobacter? Take note that Citrobacter is highly citrate positive, and of course, it is H2S positive, ang mga Citrobacter natin. But for the Serratia, it is the opposite of that, okay? And then take note that Serratia produces the red pigment known as the prodigiosin. Yan ang kanyang characteristic. So how do you get infected from Serratia? Serratia is known to contaminate parenteral solution. When you say parenteral, ito yung mga injectable solution, tulad ng mga IV fluids, and sometimes yung mga injectable drugs. They are known to contaminate that, okay? So that is for the Serratia marquescens. Next is the primary intestinal pathogen. So for this one, we're going to talk about the Salmonella, Shigella, and of course, the Yersinia. So for the Salmonella, saan nakikita ang mga Salmonella class? So you commonly isolate it from cold-blooded animals. But for the humans, you can get that from accidentally eating infected chickens or from eating food prepared by person with salmonellosis. Okay? So, pwede makuha mo siya sa food na niluto ng tao na may salmonellosis carrier or directly from the chicken or from the eggs na merong salmonella. Okay? So, anong characteristic na salmonella? Now, for the salmonella, it causes various range of infection. Pwedeng septicemia or sepsis, pwede, or bacteremia. And of course, yung common niya is the gastroenteritis, di ba? It can cause watery diarrhea. Now, saan ba ako? Ayun. So pagdating class sa biochemical testing, ano yung mga test natin na ginagawa to separate Salmonella? So you may culture that on selective mediums such as hectoenteric agar. For the hectoenteric agar class, Salmonella appears to be green colony with dark center. Meron siyang black center because of the H2S production. You can also culture it on SSA agar and also XLD agar. They appear to be red colonies with a black center because of that H2S production. After that, you may perform different biochemical testing. But take note that most of the time, the Salmonella, they are negative sa mga biochemical testing. Ang nag-iisang positive lang sa kanya is that it is H2S positive, and it also uses citrate as a source of carbon. So it is negative most of the tests except for citrate and H2S. It is citrate positive, H2S positive. Okay? So for the diseases, so nasabi ko kanina, bacteremia, gastroenteritis, and of course, typhoid fever, di ba? That is the most severe form of enteric fever caused by the Salmonella, serotype typhi. Okay? Now, other serotype that can be isolated can be the paratyphi and the choleraeosis, known to cause bacteremia or sepsis as well. Okay? Now, another characteristic ng Salmonella is that the Salmonella, once you're able to get well from Salmonella or clear that from your system, most of the time, some Salmonella can remain on your body. Particularly on your gallbladder. Doon siya naiiwas sa gallbladder mo. And then, ano mangyayari kapag naiiwas siya sa gallbladder? You can become a carrier. Nagiging carrier ka. Okay? Now, once naging carrier ka, whenever you prepare food, you may contaminate the food because whenever you defecate, you still defecate the Salmonella. And then your hands can become contaminated with the bacteria once you clean yourself. Okay? Kaya naman class, nagiging carrier ka. Okay? Now, again, ayan. So, these are the different serotype ng ating Salmonella and their differences pagdating sa laboratory test. Okay? So, again, Salmonella paratyphi, they are arabinose fermentation positive. Okay? Arabinose fermentation positive. They can utilize, they ferment glucose with gas production. That is for the choleraeosis and the paratyphi. Okay? Again, glucose fermenter sila with gas production, pero they do not ferment lactose. They are non-lactose fermenting bacteria. Okay? So those are the characteristics. Now, another one is that they do not grow in a medium containing potassium cyanide. Okay? That's your important characteristic. And of course, negative siya sa mga other biochemical tests. They are inactive. Okay? Now, next is the enteric fever. So, when you say na meron ka enteric fever, it means meron kang prolonged fever with bacteremia, and then the bacteria can spread to your reticuloendothelial system or the rest. Okay? You can go to your liver, your spleen, the intestine, also your mesentery system. Okay? So that's the meaning of the enteric fever. Now, enteric fevers, it can be caused by paratyphi. So it is commonly caused by the paratyphi A, B, and C, and of course the choleraeosis. So this is the appearance on the culture media. Meron siyang black center because of the H2S. Now let's go to Shigella. Now for the Shigella naman class, ano bang characteristic ng Shigella? So marami tayong different species ng Shigella. But ang commonly isolated natin is of course the following, especially the Shigella dysenteriae that is known to cause dysentery. So anong tawag kapag meron kang Shigella infection? It is called shigellosis. But if ever you get the dysentery, it is known to be dysentery. When you say dysentery, ibig sabihin noon, or bacillary dysentery, you have watery stool with blood, mucus, and pus in the stool. Okay? So meron kang watery diarrhea, bloody, watery diarrhea with mucoid and pus in the stool. Yan ang characteristic ng Shigella dysentery or dysentery. And then of course, you're going to have abdominal pain, intense abdominal pain. Sometimes you're going to have rectal prolapse because of the severe diarrhea. Okay? Now, another one is the Shigella sonnei that can cause Self-limiting diarrhea naman, where you can have diarrhea within 1 day and then wala na siya. Okay? You also have Shigella flexneri that can cause gastroenteritis in HIV patient. And also, other Shigella that can be transmitted by flies, your fingers, or the contaminated food and water. So these are the tests for Shigella. So for the Shigella, you may perform mannitol fermentation. They're all mannitol positive except for the Shigella dysentery. Okay? So for the Shigella, how do you culture the Shigella? You may use culture medium where you can also grow the Salmonella. Okay? You may also use H&E agar or hectoenteric agar, XLD, and of course the SSA agar. But take note that Shigella does not have H2S. Okay? They only produce clear colonies. Kapag ito ay H&E, they produce clear green colonies. If it is XLD or SSA, they produce clear red colonies. That is for the culture of the Shigella. Now, next is the Yersinia. So the Yersinia, this is a species of microorganism that can grow from a wide range of temperature. Some of them can grow at 4 degrees. Some of them can grow at 43 degrees Celsius. Particularly the Yersinia pestis, this is the most commonly, this is the most problematic species of the Yersinia because this is known to cause the plague. Okay, tinawag siyang plague bacillus. It is known to cause the bubonic plague. So how do you get the bubonic plague? The bubonic plague, you can acquire that from getting bitten, diba? By the flea from the rats. Okay, tama ba? Rat flea. O tama. Wherein you're going to have the buboes. When you say bubo, ito yung mga swelling of your lymph nodes on your axilla, groin area. And then, since swollen sila, nagiging black sila, ang tawag dun ay buboes. Okay? And then, this disease is rapidly fatal, where the patients can die because of the pulmonary failure or respiratory failure class. Nagkakaroon ng death because of the respiratory failure. So, ano class yung kanyang appearance? So, it has a characteristic safety pin appearance. When you say safety pin, if you stain it using the methylene blue or the Weissel stain, the blue stain, there's a deposit at the opposite end of the bacilli that gives it a safety pin appearance. Okay? So you have here the plague and also the pneumonic form. Okay? All of those are fatal sa pasyente. Now, you also have the enterocolitica and the Yersinia pseudotuberculosis. Okay? So for the enterocolitica naman class, how do you get this one? You can get this from eating contaminated food such as pork and vacuum-packed deli meat, beef, lamb, chicken, and chocolate milk and water. So bakit sa food? Kasi nga, this can survive sa lower temperature. Okay, this can survive sa lower temperature. Actually, class, if you perform culture, it grows best at lower temperatures, such as 25 to 30 degrees Celsius. It is also motile at 25 degrees, but it is non-motile at 35. So it is active sa more on room temperature. Okay? So how do you confirm for the enterocolitica? You may culture it on the CIN agar. It gives you, for the SIN, it gives you bullseye colony on the CIN agar. That is your Yersinia enterocolitica. The other one is the Yersinia pseudotuberculosis that is known to cause pseudotubercles or caseous swellings. Okay? So, where can you get this one? Again, from animals, from their fecal material, or ingestion of contaminated drink and food stuff. The manifestation is the same with the enterocolitica that can give the patient appendicitis-like syndromes. So, anong kanilang characteristic? It is motile at room temperature as well. It produces urease and also ferments rhamnose. That is for the pseudotuberculosis. Okay? And this is a table, summary on how to differentiate the species of Enterobacteriaceae. Now, let's go to the non-fermenting microorganism. So, when you say non-fermenting, ibig sabihin ng class, they still utilize glucose. However, they do not ferment carbohydrates. They oxidize carbohydrates. Yan ang difference ng mga non-fermenting natin sa mga Enterobacteriaceae. Another common characteristic nila is that the non-fermenters, they can also grow in the Baconghi agar. just like the Enterobacteriaceae, giving you non-lactose colonies. Okay? Now, for the Pseudomonas muna. For the Pseudomonas, this is the most commonly isolated. It has a wide range of temperature. However, it can grow up to 42 degrees Celsius, the Pseudomonas. Now, the first species of the Pseudomonas of significance is, of course, the Pseudomonas aeruginosa. It is the most significant Pseudomonas because it is commonly isolated, particularly in the hospital. This is known to cause hospital-associated infection, or what you call the nosocomial infections. And where do you get this from the hospital? Take note that Pseudomonas, it thrives in moist environment. As long as there is water, there is moisture, Pseudomonas will thrive there. Okay? Now, saan na ba ako? Okay. So, what type of infection can you get from this one? Commonly class is respiratory infection, particularly in patients with cystic fibrosis. But take note, class, that cystic fibrosis, this is a medical condition caused by a genetic anomaly. So kapag meron kang cystic fibrosis, ang nag-cause is that genetic anomaly wherein yung lungs mo meron siyang weakness. However, kapag weak lungs ka at meron kang cystic fibrosis, madali kang tamaan ni Pseudomonas aeruginosa. Kaya kung meron kang cystic fibrosis, most of the time, meron ka rin Pseudomonas aeruginosa infection. It causes pulmonary infection, particularly the pneumonia. Okay? Now, another thing that is being caused by the Pseudomonas is, of course, wound infection. Pwede rin. Pwede rin class ang sepsis. Or, particularly what you call the ventilator-associated pneumonia or the VAP. Okay? Ibig sabihin, class, nagkaka-pneumonia daw yung mga pasyente na nasa ventilator. Bakit, class? Kasi ang ventilator, meron silang water sa loob. Yung water na yan, possible na contaminated ng Pseudomonas aeruginosa. So every time na humihinga yung pasyente mo sa ventilator, na kontaminado ang tubig, nasisingot niya yung Pseudomonas aeruginosa. Okay? Now, pagdating class sa ventilator-associated pneumonia, Pseudomonas aeruginosa is not alone. You can also isolate Acinetobacter baumannii and of course the Stenotrophomonas maltophilia. All three of that are known to be popular nosocomial pathogen, particularly in warm season. Tulad ngayong summer, di ba? Maraming Pseudomonas aeruginosa ngayon sa ospital. Okay? So, anong characteristic ng Pseudomonas? So, since nagagaling nga siya sa moist environment, it is known to cause the hot tub syndrome. Ito yung mga rashes that you can get from always being, from swimming. Okay? Swimming all the time, where your body is always wet. Okay? So, magkakaroon ka ng Jacuzzi syndrome or hot tub syndrome. Ito yung rashes na nakukuha. And then sometimes, the ears can also become infected kasi nga lagi kang submerged sa tubig. So, possible magkaroon ka ng otitis externa. Okay? Because of the, tawag dito, palagi kang na-expose sa tubig. Okay? Saan na ba ako? Okay. Another one is that Pseudomonas aeruginosa can also cause UTI, particularly in patients with catheters. Okay? So again, they commonly cause UTI sa mga catheterized patient. And then once the bacteria is able to attach to the catheter, they may form biofilms through a process known as quorum sensing. So what are the characteristics of the Pseudomonas aeruginosa? Pagdating mo na class sa appearance, it produces different pigments. It produces pyocyanin, pyoverdin, pyruvate, and pyomelanin. But the most commonly isolated in the hospital is, of course, the one that has both pyocyanin and pyoverdin. That's why Pseudomonas aeruginosa may give you bluish-green pigment on the agar. Okay? Another characteristic of Pseudomonas is that it can grow up to 42 degrees Celsius. Okay? It also produces a fruity odor. And then, if you want to confirm for the Pseudomonas aeruginosa, you may perform the acetamide utilization testing, which is positive, and of course, the culture in cetramide agar. The only one that can grow in cetramide agar is, of course, the Pseudomonas aeruginosa. Okay? Now, next is, so this is the blue-green pigment, and these are the biochemical tests. Next is the Acinetobacter. For the Acinetobacter baumannii class, again, for the Acinetobacter, you have two species. You have the baumannii and the elwolfii. But the most virulent among the two is, of course, the Acinetobacter baumannii, because this is the one that has intrinsic resistance against antibiotics such as carbapenems. Okay? Kaya nga may tinatawag tayo na CRAB or carbapenem resistant Acinetobacter baumannii. Okay? So again, they can either oxidize or not oxidize glucose. If they oxidize glucose, they're classified to be saccharolytic. If not, they are classified to be as non-saccharolytic or asaccharolytic. And take note that Acinetobacter baumannii is saccharolytic. Okay, yan ang commonly isolated sa mga Acinetobacter. So what makes you at risk to getting this infection? You must be immunosuppressed or immunocompromised. Let's say meron kang HIV, you have diabetes, you're undergoing organ transplant, or accidentally, meron kang mga deep injury or deep wound injury. Ito yung mga possible na tamaan ng mga yan. Okay? Especially those people in the ICU and prolonged stay in the ICU kasi nga ito ay nosocomial pathogen. Okay? Now, next is the Staphylococcus maltophilia. Kaya tinawag siya na maltophilia because it loves maltose. It oxidizes maltose faster than glucose. Yan ang characteristic ni Staphylococcus maltophilia. It is maltose loving. Now, what is the distinguishing characteristic? Unang-una is the pigment, okay? For the pigment, it produces lavender green colonies on the blood agar, okay? Pangalawa is the resistance. It is resistant to all antibiotic except for SXT or trimethoprim sulfamethoxazole. Okay? It is only susceptible to one antibiotic, the SXT or trimethoprim sulfamethoxazole. Take note of the pigment of the Staphylococcus maltophilia. Okay? Okay. So let's go to the Burkholderia. Now for the Burkholderia, the first one is the Burkholderia cepacia. Again, this is known to cause infection sa mga pasyente na merong cystic fibrosis or CGD. So if you have CGD, it is a condition na meron kang impaired immune system wherein your body cannot perform phagocytosis. That's why nagiging prone ka sa different disease or different infection. And one of them is of course the Burkholderia cepacia complex. So what is the characteristic of this one? So this is known to cause pneumonia or pulmonary infection sa mga pasyente. And how do you isolate this? You may culture on selective medium. We have here the OFPBL agar and the PC agar. So if the OFPBL agar produces yellow pigment, if the PC agar produces red pigment, it can be Burkholderia cepacia complex. Okay? Now, next is the Burkholderia malae. Burkholderia malae is known to cause glanders in horses. But if humans become accidentally exposed, magkakaroon lang siya ng acute respiratory tract infections. Okay? Next is the Burkholderia pseudomalae. This is known to cause meningosis. When you say meningosis, this is a form of aggressive granulomatous pulmonary disease caused by ingestion, inhalation, or inoculation of the organism, wherein you may form abscess in the lungs. Okay? So, meron kang metastatic abscess forming in the lungs, going back and forth sa different areas of your lungs, okay, or your respiratory tract. Yan ang characteristic ni pseudomalae or meningosis. And how do you identify that? You may culture in Ashdown medium. The Ashdown medium, it must give you deep pink colonies for you to say na meron ka nga Burkholderia pseudomalae. Okay? And these are the biochemical tests for them. Okay. Next is the Chromobacterium. Now, for Chromobacterium class, the pathogen here is the Chromobacterium violaceum that is known to produce the violacin pigment. Pagdating class sa infection, it is known to cause wound infection and also systemic infection possible din. Kasi nga class, this is an opportunistic bacteria that targets yung mga immunocompromised patients, especially people with CGD or chronic granulomatous disease wherein their immune system is impaired. Okay, impaired ang kanilang immune system. Okay? Now, next is the Wickschellaceae. You have here the Elizabethingia meningoseptica. For this one, this is the one that can cause sepsis and meningitis in newborn or neonates. Okay? Pagdating sa mga, especially sa mga premature infants, that is the Elisabethingia meningoseptica. Now, next is the Metallobacterium and Roshomonas. Both of them produce coral colonies. Okay, coral colonies. Now, ano ang difference nila? Difference is the food source. Now, for the Metallobacterium, it is known to consume methanol. It loves methanol. Kaya tinawag siyang Metallobacterium. The other one, the Roshomonas naman, they are known to produce pink or mucoid colonies, okay, on culture medium. So that is for the first part.